Welcome to this pharmacology quiz on topical antibacterials, part of our ongoing pharmacology quiz series. In this video, we will review key drugs used to manage common conditions such as skin infections, impetigo, minor wounds, burns, and acne. This quiz contains 10 recall-type multiple-choice questions designed to test your core pharmacology knowledge. Each question has 5 options, followed by the correct answer and a brief explanation to reinforce learning. The video will pause for a few seconds after each question to give you time to attempt the answer before the correct option is revealed. So, let's get right into it. Question 1. Which of the following topical antibacterials primarily acts by inhibiting isoleucyltaurinase synthetase as its mechanism of action? Option A, mupirocin. Option B, fusidic acid. Option C, bacitracin. Option D, neomycin. Option E, retapamulin. The correct answer is option A, mupirocin. This is because mupirocin selectively inhibits bacterial isoleucyltaurinase synthetase, preventing protein synthesis and leading to bacterial death. All the other options act through different mechanisms, such as ribosomal inhibition or cell wall or membrane effects. Question 2. Which of the following topical agents is most likely used in acne vulgaris because it releases free radicals that damage bacterial proteins? Option A, clindamycin. Option B, benzoyl peroxide. Option C, mupirocin. Option D, fusidic acid. Option E, retapamulin. The correct answer is option B, benzoyl peroxide. The reason is that benzoyl peroxide generates reactive oxygen species that oxidize bacterial proteins and reduce Cutibacterium acnes counts. All the other options act through antibiotic mechanisms rather than free radical-mediated bacterial killing. Question 3. All of the following statements about topical antibacterials are correct except Option A. They generally produce fewer systemic effects. Option B. They may cause local irritation or dermatitis. Option C. They are first line for all systemic infections. Option D. They are commonly used for minor skin infections. Option E. They may promote resistance with prolonged use. The correct answer is option C. They are first line for all systemic infections. This occurs because topical antibacterials are intended for localized infections and are not suitable as first-line therapy for systemic infections. All the other options correctly describe common features or limitations of topical antibacterial therapy. Question 4. Which of the following topical antibacterials binds to elongation factor G and inhibits bacterial protein synthesis? Option A, bacitracin. Option B, mupirocin. Option C, fusidic acid. Option D, retapamulin. Option E, polymyxin B. The correct answer is option C, fusidic acid. This is because fusidic acid inhibits protein synthesis by blocking elongation factor G during the translocation step of translation. All the other drugs act through different mechanisms, including cell wall disruption, ribosomal inhibition, or membrane damage. Question 5. Which one of the following statements about silver sulfadiazine is correct? Option A. It is primarily used for fungal skin infections. Option B. It is used in burn wounds to prevent infection. Option C. It inhibits bacterial cell wall synthesis. Option D. It blocks bacterial DNA gyrase activity. Option E. It is first-line therapy for acne vulgaris. The correct answer is option B. It is used in burn wounds to prevent infection. The explanation is that silver sulfadiazine releases silver ions and sulfonamide components that provide broad antibacterial coverage in burn wounds. All the other statements describe incorrect indications or mechanisms not associated with this drug. Question 6. Which of the following is contraindicated in neonates because of risk of kernicterus related to sulfonamide absorption? Option A, mupirocin. Option B, bacitracin. Option C, clindamycin. Option D, silver sulfadiazine. Option E, retapamulin. The correct answer is option D, silver sulfadiazine. This is because the sulfonamide component may displace bilirubin from albumin, increasing the risk of kernicterus in neonates. All the other options do not contain sulfonamides and therefore do not carry this specific neonatal risk. Question 7. Which one of the following statements about topical clindamycin in acne treatment is correct? Option A. It inhibits bacterial DNA gyrase. Option B. It blocks folate synthesis in bacteria. Option C. It inhibits the 50S ribosomal subunit. Option D. It disrupts bacterial cell membranes. Option E. It prevents peptidoglycan cross-linking. The correct answer is option C. It inhibits the 50S ribosomal subunit. The explanation is that clindamycin binds to the 50S ribosomal subunit and inhibits protein synthesis in susceptible bacteria. All the other options describe mechanisms associated with different antimicrobial classes, not lincosamides. Question 8. All of the following topical agents act primarily by protein synthesis inhibition except Option A, mupirocin. Option B, fusidic acid. Option C, clindamycin. Option D, retapamulin. Option E, benzoyl peroxide. The correct answer is option E, benzoyl peroxide. This is because benzoyl peroxide exerts its antibacterial effect through free radical oxidation rather than inhibition of protein synthesis. All the other listed drugs interfere directly with bacterial protein synthesis at different molecular targets. Question 9. Which of the following is most appropriate for nasal decolonization of methicillin-resistant Staphylococcus aureus? Option A, mupirocin. Option B, bacitracin. Option C, silver sulfadiazine. Option D, neomycin. Option E, clindamycin. The correct answer is option A, mupirocin. This occurs because mupirocin nasal ointment is specifically indicated for eradication of MRSA colonization in the anterior nares. All the other agents are not standard choices for targeted nasal decolonization of MRSA. Question 10. Which one of the following statements correctly compares benzoyl peroxide with topical antibiotics in acne therapy? Option A. It is primarily bacteriostatic against Propionibacterium acnes. Option B. It promotes resistance more than topical antibiotics. Option C. It has no antibacterial activity. Option D. It reduces resistance when combined with antibiotics. Option E. It is only effective against gram-negative organisms. The correct answer is option D. It reduces resistance when combined with antibiotics. The reason is that benzoyl peroxide has a rapid bactericidal action and reduces the emergence of antibiotic-resistant Cutibacterium acnes when used in combination therapy. All the other options misrepresent its antibacterial activity or resistance profile. The quiz is now complete, and thank you for taking part in this topical antibacterials review. Please drop your score in the comments so I can see how you performed. For deeper study, consult Katsung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, as all guideline references in this video are aligned with the BNF. These resources will help reinforce mechanisms, clinical uses, and safety considerations. Subscribe for more high-yield pharmacology quizzes and learning content.